251 Canadians quarantined on a cruise ship off the coast of Tokyo after 10 people on board contracted coronavirus. They will have to wait out the standard 14-day isolation. Are these measures overly cautious for stopping the spread of coronavirus? Here to help us understand is Dr. Allison McGeer, an infectious disease specialist who actually contracted the SARS virus in 2003. We'll get to that, but first, Dr. McGeer, people's imagination runs wild when this goes right across the globe. Are we overly reactive here on the cruise ship?
Well, I think we're at a really difficult time with what's happening with this coronavirus. Up until I think a couple of days ago, we were really hoping that China would be able to contain transmission and that we wouldn't have to learn to live with this virus spreading. I think now we're all recognizing that the effort to contain the virus has failed. It's a virus that is successfully transmitted person to person. It's not possible to control its spread with public health measures. We're going to have to learn to live with it. But we still don't know exactly how dangerous it is, and there's still not much of it in countries outside of China. And so people are saying, maybe we want to slow this down. And because of that, they're having to make a number of really hard decisions about whether people are quarantined and how they're quarantined. So I think the scientific evidence suggests that quarantining that cruise ship is probably not the right thing to do. Wow. But it's a really difficult decision to make.
Okay, so what should we do as Canadians, as people in America, wanting to stay safe from coronavirus?
Well, I think the first thing to recognize is that at this moment, today, tomorrow, probably for the next week, there is no transmission of coronavirus going on in Canada or the United States. Nobody needs to worry. You don't need to change anything.
Wow.
But
don't wash our hands. Don't worry about that.
No, I didn't say. I'm assuming you're washing your hands 5 times a day anyway, because you don't want influenza.
Okay.
Right.
Okay.
So this isn't about not doing things to protect yourself from respiratory viruses. This is about not doing anything different, because you don't have to protect yourself against coronavirus at the moment. Okay. But it's almost certainly true that it's coming, and that arrival might be measured in weeks. It's really hard to predict what kind of time frame we're talking about. And when it comes, then people are going to want to think seriously about intensifying the making really sure that you clean your hands with soap and water or alcohol hand rub 5 times a day, making sure that you cough or sneeze into tissues, into your sleeve if you have to, making sure that you keep your hands away from your face, making sure that if you get sick, you stay home so you don't infect other people. Those are all things that we know will slow the spread and help protect people. They're pretty boring. It's going to be hard because those are the only things we have to protect us, but they are important.
Okay. You had SARS in 2003. Tell us what you wish we could have done for you as a medical worker then, or your advice for the medical community as we face another epidemic like this.
So my job is infection prevention and control, and I don't think that anybody failed in protecting me during SARS. We had no way of knowing that the virus was coming to Toronto, was in Toronto at the time it started and the time I got infected. We were not well prepared for it, either globally or in hospitals in Ontario. That situation is very different now, but I think there are likely still going to be some risk to healthcare workers. It is, I think, going to be a challenge in all healthcare settings to make sure that healthcare workers are protected from the people they care for, in the same way that it's going to be hard to protect everybody living in society, which is what we'd like to do, right? Healthcare workers and everybody else are not different. We want to be able to protect absolutely everybody.
Yeah.
So we are so much better prepared than we were before, and there are a great many things will work, but it still is, I think there's a possibility that this is going to be another tough time in healthcare, where there are going to be more than usual sick people, and more than
Okay.
usual sick people that you
And
have
Dr.
to protect
McGeer,
yourself from.
you reminded us, influenza or coronavirus, be just as vigilant for what we would call the common influenza, because it has already killed Canadians this winter.
Yeah. This is kind of a balancing act, right? I think we're probably overly fearful about the coronavirus, although, until we know just how serious it is, and that data is evolving, but we don't have a really good sense yet. It's hard to know how worried to be about it, but there's no doubt that we don't worry enough about influenza. So it is important to hold on to the fact that there are lots of respiratory viruses around. They do quite a bit of damage now, and we live with them. So adding a new respiratory virus to that mix, may not be that big a deal. I think we're still all really hoping that this virus is not as dangerous as influenza is every year. And while that doesn't mean there's not going to be illness and hospitalizations and deaths associated with it, it may not be a really difficult thing. We might see something that just looks like a regular influenza wave in the winter, and that we can cope with pretty well. That's I And it might be better than that.
All right.
We can hope for something better than that.
Okay, thank you, Dr. McGeer, for reminding us to be cleaning our hands 5 times a day, sneezing into Kleenexes, and avoiding people who are having respiratory contagion. So whether it's influenza, the common cold, and hopefully not the coronavirus. So thank you from Sinai Health System in Toronto. Thank you for joining us.
Pleasure to talk to you. Take care.
Hit subscribe and the notification bell to get our weekly episodes and web exclusives.